All right, welcome everyone. It's 3 o'clock. We're going to go ahead and get started. Good afternoon. My name is Colin Bader, and I'm going to be your host for today's event, Viral Planet, the Infodemic in Environmental and Health Sciences, in which 3 UNE experts will discuss how we can navigate a crowded information marketplace to decipher reliable science and defend essential environmental and health initiatives against the threat of misinformation. I am an assistant clinical professor here with the UNE Health, Wellness, and Occupational Studies program. I am also a member of UNE's Planetary Health Council, the group bringing you today's event. Since 2017, UNE has been an institutional member of the International Planetary Health Alliance, a Harvard-led consortium of more than 240 universities, non-governmental organizations, and other institutions spanning more than 40 countries. At UNE, our Planetary Health Council is working to strengthen bridges between our robust environmental sciences and health professions programs, and to provide planetary health content through academics, research, and events like this one. Today's event is brought to you through a partnership between the Planetary Health Council and the Center for Excellence in Collaborative Education. This event will address interprofessional competencies of values and ethics and communication, and can be applied toward UNE students' Interprofessional Honors Distinction Badge. Today's program will begin first with introductions from today's speakers. Then the panelists will give their presentations on this important topic. We are then allocating ample time for audience participation and discussion with all of you, as well as our closing remarks. I will now invite our discussion moderator to introduce herself, Melissa DiStefano.
Hi, everyone. Good afternoon. I'm the Integrated Content Specialist in the Office of Communications here at UNE, and I also completed my undergrad communications degree here. So I graduated in 2017 with minors in environmental studies and business. I will be moderating today's discussion, so I'm very interested in hearing from all of you. I invite you to please ask your questions and comments in the chat and include your major, program, department, or profession. I will now hand it off to our first panelist to introduce herself, Sonia Durney.
Hello, good afternoon, everyone. My name is Sonia Durney, and I am the Scholarly Communication, Research, and Teaching Librarian at UNE Library Services. I work mostly on the Biddeford campus and also online quite a bit these days. I'm also a student currently. I'm in a doctoral public policy program at USM's Muskie School of Public Service. So I spend a lot of time thinking about credible resources, which is what we'll be talking about today. I'm looking forward to the conversation. And I'll introduce our next panelist, Dr. Brian Duff.
Hi, thanks. So yeah, I'm Brian Duff. I'm a professor in the Department of, well, no longer the Department of Political Science, but I am a political scientist in the School of Social and Behavioral Studies. And while my real expertise is around the family and politics, I've also published some work on public opinion. And that's what I'll be talking about today. And so next is Jennifer Gunderman.
Next is Jennifer Gunderman.
My name is Jennifer Gunderman. I'm an assistant clinical professor at the University of New England, also the director of the Maine Area Health Education Center Network, which is housed here at the University of New England. I am trained as an epidemiologist, spent most of my career as an infectious disease epidemiologist. And thanks for COVID and epidemiologists being in the news a lot, everyone knows that I'm not a skin doctor and I don't study rocks. So I look forward to being part of today's presentation.
All right. Thank you, everybody. As you can tell, we have a truly remarkable group of experts gathered here today. I'm now going to turn it back over to Sonia Durney, our first panelist, to share her expertise in information literacy, research, and scholarly communication.
Great, thank you. So let's see, I wrote out my notes here, which I normally don't do, so I'm hoping I don't turn into a robot as I'm reading them. So let me see, get our slides up, perfect, thank you. So the COVID infodemic has brought information issues to light as we are faced daily with information overload while we're also socially distancing and relying on our phones and social media more than ever to connect with the outside world. What I'm trying to convey in this first slide and what I'm here to tell you today is that misinformation and disinformation are not new. There have always been folks out there promoting the health value of snake oil. In fact, the term fake news has been around since the invention of printing presses way back in the 1500s, whereas objective news has only emerged a little over a century ago. And it's not just the press. There are all sorts of bad information out there. There's predatory journals that are publishing bad science. And even all of us, most of us have probably been guilty of resharing bad information over social media, hopefully by mistake. The terms misinformation and disinformation are often used interchangeably, but they actually have different meanings. Misinformation is false information that is spread regardless of intent to mislead, so it's a mistake. The Oxford English Dictionary traces this term back to the late 1500s. Disinformation, on the other hand, is deliberately misleading or biased information. It's manipulating narrative and the facts. And the OED traces its use back to the 1960s as applied to Russian propaganda. So you can see here that the difference between misinformation and disinformation is the intent, with misinformation being more of a mistake, and disinformation, the intent is to share bad information, whether it's for financial gain, for political gain, there are all sorts of reasons, but it's done purposefully. One similarity is that both misinformation and disinformation are rampant and have led to our current infodemic. Infodemic itself is also a relatively new term. It was added to the OED only in 2020, but has been traced back to 2003 and the SARS infodemic. So that word's been floating around for a little while. So why does the infodemic matter? It's clear with COVID that information can be a matter of life and death. But furthermore, disinformation is spreading hatred and incivility in our society. And it's really important to note that disinformation is all over the political spectrum. It's not just from the left or the right. Misinformation and disinformation are also hijacking the democratic potential of the internet, the sharing of open data, open access publishing, online community forums. All of these are being challenged. So clearly, we do have an information problem. Next slide, please. So what can we do? As far as I see it, we all have a role in fighting the infodemic. We are all information consumers and sharers. And the good news is that there are so many tools available. There's checklists, evaluation worksheets, all sorts of tools you can use to check the information that you're using, that you're sharing. I'm not going to go through all of these today, but I will drop some links in the chat box when I'm finished speaking with some links out to some resources. So what can we do? We can be sure to evaluate our resources. You'll see here on the slide, I have a picture of the CRAP test. We librarians love the CRAP test, looking at information and thinking about whether the information is good information to use and to share, or if it's crap by looking at its currency, its purpose, its accuracy. So that's one of the checklists we like to use. And it isn't always just applied to academic resources. Of course, peer-reviewed articles and evidence-based research is the gold standard. But now in the 21st century, we also really need to know how to listen critically to podcasts, how to use Wikipedia as a starting point for information, hopefully not the ending point, but it can be a helpful starting point, and how to sift through the endless information that we're finding on social media to find truth in what's being shared there. So evaluating our resources is one thing we can do. We can also really choose wisely how we're viewing our news and coming across our news. The infodemic is growing as trust in the media and high quality news sources are declining. According to the Pew Research Center, trust in the mainstream media is on the decline. And at the same time, U.S. newspapers have shed half of their employees since 2008. So there's less local reporters out on the beat getting the scoop, less experts in specific topics weighing in on current events. So the infodemic is rising and quality news is declining. So this is clearly a problem. So we want to be really mindful that we're choosing good news sources. And there's tools for that too. On the screenshot here, I show a picture of the Ad Fonte media bias chart. So this is just one of the tools you can use to look at your news sources. What this group does is they weigh the accuracy and the bias of newspapers. They have researchers from different political bents looking at all of the newspapers that are out there and rating them on their accuracy and bias. If you look at their website, which again, I'll share the link to that, you can really take a look at their methodology, and you can do your best to try to read news sources from the green zone, which it's kind of hard to see on this slide, but the newspapers sort of towards the center and towards the top have the least bias and the highest amount of accuracy. So that's the green zone. And another cool thing you can do on this website is enter in the news sources that you are using, even if they're not in the green zone, and sort of look at how they add up. So again, that's just another tool you can use there. Another thing to keep in mind is that caring is not always sharing. So don't share BS. And by BS, I mean bad sources. Before you share things, pause for a moment. Fact check. I think it's been really interesting, and I'm sure it will continue to be interesting, to watch how big tech companies like Facebook and Google are working to stop the spread of misinformation. However, again, I really feel we all have a role to play. And I also believe that social media can really be a positive space to share information and have civil conversations. I do believe that we have the power to use this space for good and not for spreading information. Another thing I think we can do as information consumers is to make sure to step outside of our filter bubbles and our echo chambers to seek diverse points of view. If you're looking at an issue, make sure you're looking at both sides of the issue. Look at what the critics of your view have to say. The library, again, has some great tools for this. We have a wonderful database called Opposing Viewpoints, which has tons of great information. But also, you can talk to people. Talk to people you don't agree with. Listen. Ask them clarifying questions. And of course, I want you to remember to be civil. So again, I think we all do have a role as consumers, information consumers, to share and to fact check responsibly. Next slide, please. So in addition to being responsible consumers, there's also education. There's plenty of research out there that finds that the amount of education and information literacy a person has leads to better recognition of misinformation. So educators, keep educating. Include media and information literacy in your curriculum. We all need to be lifelong learners because the way we consume information is going to continue to evolve. And I know it's really cliche for the librarian to come on and say information literacy is the key. And there's also plenty of pushback out there on information literacy teaching methods relying on outdated models. Here in academia, we heavily rely on library databases where safe, peer-reviewed information lives. And peer-reviewed and evidence-based information is, of course, the gold standard, and that's what we're striving for when we're looking for information. But that's not always what we're going to come across first. So with information literacy, as I alluded to before, I think we need to be open to expanding what we include, to include things such as navigating the open access publishing landscape, knowing how to find legal information and government published information, and research various policies. Perhaps recognizing that preprint health information and being able to frame this information as findings that are scientifically uncertain and lacking peer review, but also as really potentially important scientific findings. We also really need ourselves and our students to know how to properly use and evaluate free online tools. As educators, we're always advising students not to go directly to the web for information. But here we are in a privileged place where the university provides us with access to tons of information behind paywalls. This is academic privilege. Many folks only have the web, and that's if they have the internet at all, but the digital divide is a topic for a whole other panel. But at any rate, the information out there, consumers need to know how to evaluate endless information from a variety of resources, including free online resources, and not only the resources that are afforded through academia. So all of this, looking at all these different resources and not always being peer reviewed, can really lead to some ambiguity, which brings me to UNE's vision. Which part of UNE's vision calls for habits of mind to include cultural, quantitative, and information literacy, critical thinking, tolerance for ambiguity, and problem solving. So in my mind, we really can't have information literacy without these other factors. So all of these habits are linked together, and I think it's really important that we all work together towards this vision. Next slide. Another way to combat misinformation is to fight bad information with good information. So we really need a marketplace of ideas and information sharing that is free of censorship and accessible to those doing the work. So I call on researchers and scholars to keep getting information out there. It's our job to get our information out to those who can put it to good use. I really think it's important that we all spend time thinking about how dense scientific information can be disseminated so it's widely available in clear language that could be understood across disciplines and by non-scientists. Information that's shared widely and in appropriate formats can certainly influence local policies, communities, consumer choices, entrepreneurial ecosystems, education, and so much more. So let's keep getting the good information out there. And all that said, drowning out bad information with good information has also been likened to directing a trickle of truth against a tide of misinformation, or fighting a wildfire with a water pistol. True? Probably. But I don't think it means we should stop. I think we need to keep going and keep sharing out the good information and try to drown out the bad information. Next slide. So while I am hopeful that information literacy and education can positively impact our information future, there will always be struggles with information overload, bias in information, and sorting the good information from the bad information. Even as a librarian, as an information professional, it can be difficult to engage the huge influx of information available. At the end of the day, I really think we all need to be able to think for ourselves and use common sense. Just asking simple questions when you come across information. Who is behind this information? What's the evidence? And what do other sources say? So a little fact checking, a little common sense, and asking some questions. Traditional library science fact checking and evaluation lists, which we do still rely on and promote, reflect and encourage a simple binary, is it good or bad, understanding of information in a complex world. So this brings me back to the UNE vision and why it's so important that we pair information literacy with critical thinking, tolerance for ambiguity, and other habits of mind. Do librarians have the vaccination against the infodemic? Sadly, no. But we librarians are certainly willing to get in the ring with you to fight the good fight for credible and accessible information. So that is the infodemic from a librarian's perspective. And with that, I would hand it off to the next speaker, Dr. Brian Duff.
Thank you so much, Sonia. Yeah, Professor Brian Duff will now examine the infodemic from a political science perspective.
Okay, thanks. I'm happy to be here. So let's just scoot right in. All right, so I'm going to talk about sort of an incredibly common finding in political science about how people tend to get their ideas. It has to do with where the information for their ideas comes from, which is the top-down model. So let's try the next slide. All right, so this is a very, very, very classic pattern in public opinion. This is not real, I just drew this. But if you were to look for the people's opinions on any topic that's in the news, you really have to know, are these people who are kind of like low info people who pay very little attention to what's going on in the news, the gamer off on the left there, or are these high info people who do a lot of reading, you know, who are up on what's going on. And what you find is that these two groups actually split based on their predispositions politically. Usually Republicans and Democrats are actually like people of low info. They're like, I don't really know what I think. And their opinions tend to be sort of similar. People with high info, their opinions tend to split. And this is Democrats and Republicans, but not just Democrats and Republicans. It's people who are like call themselves independents, but kind of lean one way or the other. So next slide. So just to restate it, the more information you have doesn't necessarily get us all to the same place, right? More information actually can be very intense disagreements. A good example of this is me and my brother-in-law, Ed. We both have a ton of information and we make the rest of the family crazy because we have intense disagreements. So, okay, next slide. All right, and this happens, so if you think of the green zone that Sonia was talking about, very good sources of news, it just doesn't really matter. The classical pattern still happens because we're just very good at reading a news story and filtering out the messages from the political elites that we don't like to listen to, and tapping into the messages from the ones that we do, right? So some people are like, oh, Bernie said that, and they love it. And some people are like, oh my God, Bernie said that. That's the stupidest thing I ever heard. You both read what Bernie said. It's just you reacted to it in a different way. So this is the common dynamic. And I'll show you how it actually works with some real data. Maybe next slide. So, oh yeah, so here you go. This is some old data, but real data. So this is, if you look at the idea of Medicare for all, for example, right? If you ask like people who don't pay a lot of attention to the news, most people are like, I don't know, government running it, yay. But like if you're a pretty sophisticated Democrat, you read a lot of newspaper articles, you've kind of gotten talked into the idea. Path to citizenship for undocumented people. I apologize for the wording there. That was from the survey. Same thing, right? Most people, low information, have their doubts, but sort of like Democrats with high info have kind of gotten on board with the party's message. We do the next slide. All right, here's a couple more. Like take raising taxes on the wealthy, right? People with low info are like, duh, yes, of course. Why wouldn't you do that? But if you're like a pretty sophisticated Republican, you run into the Republican arguments that explain like, actually, because of trickle down, blah, blah, blah. And they've convinced you that actually, no, we should not raise taxes on the wealthy. We should cut taxes on the wealthy, which is what we did in 2017. And then this is some, again, I want to say older data about government action on global warming, where, most low information voters just, they didn't want the government to get involved. They were very afraid of like a gas tax. But well-informed Democrats absorbed kind of the messages that this was a crisis. And at the end of the talk, I'm going to talk a little bit about how I think this pattern might have changed a little bit when it comes to global warming. But so that's the basic idea. More info does not lead us to the same destination. So let's try the next slide. All right, and you can see this. This is so intense that you can just see the second elites switch, opinion switches with it. So in this graph, over on the left side of the graph, you have, it's so funny, it's like my image is cut off and I can't see the bottom. I'm forgetting exactly what years this graph is. But so you have, I believe you have Obama. Yeah, this was Obama being president on the left. So Republicans thought the economy was doing terrible. Democrats thought it was doing pretty well. And then it switches. Suddenly Trump is the president. Republicans are like, yeah, the economy is doing gangbusters, right? And the Democrats switch, when in fact the economy basically stayed completely steady. And next slide. Thanks, Colin. Right, and this is same idea, but once again showing the way that higher amounts of information affect people, right? So this is on the left, we have 2007, George Bush is president, and Democrats are a little bit more worried about the deficit than Republicans. And the more info you have, Democrats are pretty steady, but Republicans, there's a small decrease in their worries. Then 4 years later, Obama is president. And as you can see, well-informed Republicans are suddenly completely freaked out by the deficit. And well-informed Democrats are like, no problem. We'll pay it back. So really like common and almost inescapable pattern in American politics, this effect of having more information. So what do we do? Let's try the next slide, Colin. Thanks. Oh, yeah, so another recent example. So this, again, this is not real data. This is basically what I think happened, right? So any issue where there is a clear disagreement between partisan elites, you will see some version of this pattern. So I think this is basically what happened to social distancing and wearing masks. is you just had such a clear distinction between what the partisan elites were saying. And so it doesn't matter how much good research would convince you that social distancing and wearing a mask is a good idea. If the conservative elites were sending the message that masks are weak or masks are trying to control you, people were going to tap into that. And so even in what seems like such a clear basic science issue, this pattern tends to hold. And you saw that. This is the famous moment where Trump, he had COVID, but he pulled off his mask and then walked into the White House and immediately exposed everybody working there in COVID. Okay, next slide. All right, so what does this mean, the takeaway? You know, it really means that elite messages just matter an incredible amount, and it's very hard to escape this pattern. And so it just really matters how responsible our partisan elites are in the messages that they send. This was in a study with an interesting finding. It looked at, it was a global study. So it looked at millions of pieces of information about COVID-19, and it found Trump at the source of like some incredible percentage of it all. 41%, I think, of all misinformation, because his voice was so loud and he was so persistent. And so this is just one form of misinformation, the idea that there are these miracle cures that are going to come and do it. And every time Trump brought it up, you know, the idea spiked all over the world. So elites really matter. So what does that mean? Let's go maybe next slide, Colin. Oh, so I almost feel like I skipped a slide, but okay, but occasionally elites do agree, right? And I think we're seeing this right now when it comes to getting a vaccine, right? So this is a case where Trump and the Republicans take a lot of credit for the way Operation Warp Speed went and for the fact that we have effective vaccines so quickly, which it seems like an incredible accomplishment, right? And Democrats as well believe the vaccine is the solution and incredibly important. And so what you get is that among some low info citizens, you know, there's a little bit of suspicion about vaccines, maybe a little bit less eagerness to get it. But the more info you have, whether you're a Democrat or a Republican, you're more likely to have heard messages that this vaccine is an important breakthrough and you should go get one. All right, so the pattern doesn't always hold. It just depends on the elites so much. Okay, one more slide, I think. All right, so the solution, you have to choose your elites wisely for sure. I won't dwell on that. And I think I have another slide. All right, and this, you know, right now, this is the big challenge in our politics. And we're seeing one of the two major parties, the Republican Party, really almost being torn apart by this question. How responsible are their partisan elites going to be, especially around these issues of truth and information? And they're fighting it out right now. Can I go one more slide? Right, and so this is the fight happening, right? So we have some conspiracy theorists in the Congress. We had some conspiracy theories coming from the White House. And then we have other Republicans who really think, you know, it's incredibly important that the party not become known for this. And this battle is going to play out in the next 2 years for sure. And do I have one more slide, Colin? Oh, I have two more. Another solution, right, is just if one party stops giving reliable information, you know, it could just shift the balance of who pays attention to what party. And there is some evidence that, you know, the Democrats are getting more votes in general. More people are identifying as Democrats. Now, Republicans are holding on to a lot of political power, but they've lost, you know, 7 of the last 8 presidential elections. They get fewer votes for the House and fewer for the Senate too, even though it's tied 50-50. So, you know, it might be that one party is just going to influence more people moving forward. We'll see. And then I think I have one last one. Oh, yeah. So, and then finally, I want to end on a hopeful note. So I do think we have reached a turning point when it comes to taking the climate crisis seriously, where there's a general baseline that people recognize that this is a problem. There are very few Republican elites who are spending a lot of time sending the message that it isn't a crisis. They certainly send different messages about how to deal with the crisis. So I think, the pattern can shift, and I see a shift happening on climate in a way that I think is encouraging. And I will leave it there. Thanks.
Thank you so much, Professor Duff, for sharing your expertise. We're now going to have Professor Jen Gunderman discuss infodemics from a public health epidemiology perspective.
Hi, thanks for being here today. It's interesting listening to the prior two presentations, and I'm certain that we're all sitting back and kind of digesting it. And, a couple of things that I've learned so far is that, and seeing in some of the comments, that evidence-based science is affected by political elites, and that's going to be important for you to know as you go into your practice as a public health or healthcare or whatever profession. And I've also learned so far that librarians have really cool acronyms, way better than we thought public health owned the acronym soup, but librarians, I think you've won us. But I would like to challenge if the Weather Channel is really one of the most unbiased sources. I tend to think that they are biased towards scaring out people in the Northeast that we're going to have a major winter storm. So today I'm going to spend a little bit of time talking about infodemics from an epidemiologist and a public health perspective. And so I believe that it's going to take a public health approach to be able to address infodemics and misinformation. And you all can be a part of it. Next slide. As an epidemiologist, I could look at this slide all day. And this really summarizes our work in public health, no matter what the health issue is. So just quickly in the chat, quick word association. When I say the word outbreak, what is the words that come to your mind? Just quickly in the chat, jot down, what is a word that comes to your mind when I say outbreak? Bad, spread, death, quarantine, cooties, dangerous. Great. Exactly. These are all words that are associated with outbreak. An outbreak in its purest definition is a sudden increase in occurrences of disease in a particular population during a particular time. It's also used interchangeably with the word epidemic. In a very technical way, from an epidemiologist, an outbreak is really more than what you expect of disease. And what's great about this picture that helps us summarize what a definition of outbreak is it starts with just a speck, a little tiny bacteria, a little tiny virus, and then it can spread. And sometimes it can feel like it's out of control. Now, outbreaks come in different flavors and sizes. There's different causes, there's different contributing factors, and there's twists and turns in any outbreak that I've been involved with investigating. But there are a few things that outbreaks have in common. They start small and they can get big. And the key words in outbreak are amplification and replication. Next slide. So going back to what was even explained in an earlier slide, but what is an infodemic? So an infodemic, I'm not going to read these definitions, but Merriam-Webster has this definition. What's even interesting is infodemic is on their sort of words they're watching because it's being used so often. And what I really want to highlight here is the words that it's rapid and far-reaching spread. And this next quote comes from the person who coined the phrase infodemic that was mentioned when in an article called When the Buzz Bites Back. This was in the Washington Post. And you can read this definition, but again, the words I want to highlight are amplified and relayed swiftly. Now, interestingly, with this definition, when it came out in 2003, and it mentions that technology can play a role in that spread, this was before social media. This was years before Facebook, years before Instagram, before that was even coined. But if we look at those definitions, we see some commonality in the words. And again, around rapid, spread, urgent, But instead of talking about a pathogen, talking about a bacteria, a virus, a parasite, we're actually talking about misinformation. Next slide. So really, if we were to overlay our big sneeze photo with misinformation, we can see what happens here. It starts off really small. It amplifies and replicates and spreads. And we can even see in the last photo is then you can have sort of breakoffs of clusters of outbreaks. So really what we need is an epidemiological response. And what we're going to do is apply really the steps in how, as an epidemiologist, I would investigate an outbreak. And my argument is that if we use those steps, we could control the misinformation infodemic just like we control salmonella. Next slide. So why is this even important? And these are quotes that are from the World Health Organization, the UN, that basically why this is a problem, particularly with COVID-19, is because the misinformation infodemic is causing poor health effects. It's causing economic issues. It is causing harm to us as individuals and as a community. Next slide. So the first thing we do in an outbreak is first we need to identify and confirm that an actual outbreak is happening. And what that means is when we identify an outbreak, we think, is there more than expected cases? So when thinking about infodemics and misinformation, well, we don't have cases of disease. Are we seeing more misinformation spread than what we expect? We know that there's going to be rumors. We know that there's going to be myths that are spread, but is it more than what we would expect? And this is a great graph from a researcher at the University of Michigan who looked at misinformation that was spread in newspapers in India. And what you can see is a dramatic increase in misinformation in media over this time period. So if I was an epidemiologist and that line graph represented some type of disease, I would say we have an outbreak on our hands because we are expecting a sudden increase. It's more than we expected and it's amplifying. Next slide. So once we've confirmed that there's an outbreak happening, and in this terms, misinformation, we try and describe what is actually happening. And I really appreciate this, this graphic that's provided by Rutgers Institution, because what this basically says and how it describes the infodemic, and again, this was just one study that they looked at, was that 59% of the information is misinformation that's been reconfigured. What that means is the information might have a sliver of truth to it, but that truth has been spun or twisted. Whereas 38% has been fabricated, which is basically manipulated information that could be completely false. So if we were to describe this infodemic, we're talking about information that might somehow be aligned with some truth and information that is completely made up. And then we have a little bit of satire and parody. Next slide. So when we describe, we also look for examples. I'm sure you're all familiar or you've heard these pieces of misinformation related to COVID-19. The virus spreads through 5G. That would be a fabrication. You can protect yourself by gargling bleach or using essential oils. We could actually maybe even say that this might be more of a fabrication because we know that using bleach to wipe down surfaces can get rid of the virus, but not necessarily gargling. So in some ways, you could almost see that's a fabrication. You can get a face mask exemption card so you don't need to wear a mask. Oh my goodness, I saw that flying through social media with some of the groups that I sort of watch. New coronavirus was deliberately created or released by people. That's a falsehood, that started with us about a year ago. Next slide. So now that we've confirmed that there's an outbreak of misinformation, we've been able to describe it in some way, we try and determine what the causes and contributing factors are. We need to know this information so that we can understand what is amplifying and replicating the cause of the outbreak. Now, misinformation, as mentioned before, according to Clara Waddell, co-founder of First Draft, identifies 3 reasons why misinformation is spread. It's for financial gain, meaning that misinformation is going to make somebody rich or at least richer. is for political gain, which means the misinformation is going to allow somebody to increase their influence and power. And the last one is for experimental manipulation. Basically, someone puts misinformation out there just to see what happens. Being a mom at one point of 3 teenage kids who are now older, I feel like I have been victim to all those reasons for misinformation. And looking back to some additional research around causes and contributing factors, this first body of research is the one that Professor Duff just mentioned about corona misinformation, quantifying sources and themes in the COVID-19 infodemic. This was the piece of study that found Donald Trump as the largest contributing factor to amplification and replication of misinformation. This study also showed that not just social media played a role in amplification, but specifically instant messaging like WhatsApp and iMessenger. In the second study, COVID-19 social media infodemic also pointed out that social media plays a role, but more specifically, IM messaging. Next slide. An additional study that was done by a number of academic institutions also looked at contributing factors for the spread of misinformation. And this is just one, like as any scientist would say, this is one study which should be taken as just that information. It is not reporting on causation. There might be a little bit of association. But what this study started to shed light on, well, what were the factors that we need to consider with the misinformation? First, it showed that the highest levels of belief of misinformation were particularly under people under the age of 25. The research also showed that African American and Hispanic respondents were most likely to respond not sure to false claims as compared to white non-Hispanic respondents. The study also showed that men are most likely to believe false claims. And it started to show, again, an association between those instant messaging apps and believing in misinformation. More importantly, what this body of research found is that more research is needed. And these are just pieces of information that shed light on the issue and help us to develop interventions for prevention and control. Next slide. So that then brings us to prevention and control. So as an epidemiologist, I've confirmed that there's an outbreak of misinformation. I've been able to describe the misinformation, and I've been able to get little pieces of information on causes and contributing factors to this outbreak. So now we got to implement some prevention and control measures. So the first thing is to directly correct the misinformation. As an epidemiologist, one of my subject matter expertise was in foodborne outbreaks. If there was an outbreak of salmonella due to raw eggs, we would be spreading the correct information, unfortunately, that you can't eat raw cookie dough. So just in the same way that we would do that with an infectious disease, we should be doing it with the misinformation, going right to the myths and the rumors and the misinformation and providing the correct information with the sources. And here's an example of that. Next slide. The other thing that's important around prevention control is to actually change behavior. And in public health, we have a number of theories and models that we use around health behavior change. And the health belief model reminds us that our own perceived risk, severity, benefits that definitely influence our health behavior. So we need to consider that when combating misinformation, that people are coming to that misinformation with their own perceived risk, severity of disease, benefits. I give my dad as an example. My dad fits that category of being very vulnerable to believing and spreading misinformation. He could be one of those bacteria or viruses. He is 76 years old. He did not complete high school. He has a grade level reading of about 4th grade, but he wears a mask. And he wears a mask because, one, he tells people that he could get very sick. He has COPD, which is true. So he understands the severity. And he tells people, I want to get this pandemic over with so that I can see my grandchildren. So he sees his perceived benefits to wearing a mask. We can see here, this is an example from the University of Vermont. Of course, they know their audience. They understand the perceived benefits if the pandemic becomes under control. You can keep their institution open. They can have queer prom in the Davis Center. They can go snowboarding. So these wonderfully targeted messages really hit to the population to change behavior. Next slide. Another way to prevent and control is to combat it at the source. If you all went to a restaurant with you and your family someday and you all got sick, more than likely you're going to report that to the state health department. Well, the same thing should be done with misinformation. Misinformation that is online can be reported. And here's a slide that provides how that can be reported to the different social media apps. Remember, instant messaging was one of the most associated sources for amplifying and replicating misinformation. Next slide. This is a great website that you can go to, the BBC put together around the spread of misinformation. Next slide. So the message I want to send is we need to treat the infodemic as an outbreak, because that's exactly what it is. And what that will involve in going forward is collecting ongoing data. We need to collect data around misinformation. Just like the research study that was done with the University of Michigan, there are other things that we can do to collect information that is being done. For example, Google, they can be using their data for what people search on to understand what questions people have about health issues, so that correct information can be pushed in a timely manner in the correct places. Health insurance companies are actually looking at the call data that they receive to see what questions people have, so that they, again, can push out correct information. In other parts of the world where radio is an important part of people's lives, in talk radio, there are actually data specialists who are collecting qualitative information on what type of questions and what comments people are making on talk radio, so they can identify what misinformation is being spread, by whom, how, all those questions, the who, what, when, and where. Second, just like we treat an outbreak, we need to treat the outbreak of misinformation with urgency. We need to be able to push out correct messages in a timely manner. Here in Maine, like many states, some diseases start an investigation within 24 hours of that disease being diagnosed or identified. We need to vote the correct resources in public health, in IT, to be able to identify, describe, determine the contributing factors and causes, and implement prevention and control. We need to ask questions. We need to ask the questions of the what, who, when, where, and how, and ask it at the community level. And lastly, this is going to take everybody. It's going to take all of us to be able to pull off this public health approach. Last slide. So I think Malcolm Gladwell does a really great job in summarizing what an outbreak is and how we can play a role. The tipping point is that magic moment when an idea, trend, or social behavior crosses a threshold, tips, and spreads like wildfire. So my question is going to be, at that tipping point, are you going to play a role in preventing the spread of misinformation and spreading correct information? Thank you.
Thank you so much, Professor Gunderman, and to all of our panelists today for sharing your wide breadth of knowledge and expertise on these important issues. So for the next portion of today's event, we are now going to encourage questions and comments from you guys, all in the audience. For viewers on Zoom or Facebook Live, please type your questions in the chat. Please type your stories, your reactions using the chat function. We want to hear your perspectives on all these urgent issues as current and future leaders in the health professions and environmental sciences, and also as engaged citizens of our community and our world. Our discussion moderator, Melissa DiStefano, will facilitate the conversation.
Hi, everyone. Thank you so much to our panelists for all of their comments. We had a couple of great comments in the chat from students. So 2 OT students, Carly and Corey, commented on being future OTs and said that they will practice careful techniques when receiving information to be able to use that in practice and know what is right and what's not right to be doing and implementing. And then Ashley, a nursing student, said, I'd like to see intersectionality prioritized in information so that practice can be informed and accessible toward all bodies. And then we do have a question that came from Facebook. And the question is, how much does the financing of elections impact our selection of elites? And I believe this is directed towards Brian Duff's comments.
So, yeah, I mean, I can take a stab at that. So one thing that's just been fascinating to watch and very unexpected is it was always political science. We actually had this slogan for how presidential candidates got selected, which is the party decides. And there's always a sense that even though there's going to be a lot of chaos, in the end, the candidate who's got the most endorsements from the most other elites in the party is going to be the candidate and get the most endorsements and have the most fundraising. And so it did tend to sort of funnel kind of like establishment figures into running for president. People like Bob Dole, people like John Kerry, you know. What's changed in recent years is that candidates are raising insane amounts of money through small donations. They're pushing out emails, they're having, you know, videos go viral, etc. And the small donation money is swamping the establishment money, and it is making it possible for a very different set of people to be viable candidates in the expensive process that is running for office. And just to give an example, this woman in Congress who's kind of like a QAnon conspiracy theorist, who's the subject of a lot of talk these days, every day is trying to raise money off of it for her next election, and has been raising more money than any other member of Congress in the last couple of weeks. And so it does feel like the funding scene has changed in a way that maybe could be problematic, even though in another way, of course, small donations, you know, give Bernie a lot of credit for creating this path, seem better, but they also could be problematic when it comes to when small donations are based on whatever info goes viral, as opposed to sort of like carefully considered analysis.
Thanks, Brian. We do have one more question. So what can we learn from other countries' strategies for responding to misinformation? And this could be for any of the panelists.
That's a really great question. There isn't a lot of literature that I've seen from a public health perspective that provides best practices in combating the infodemic. As a matter of fact, the World Health Organization just had its first conference on infodemics last June. So I think there's still a lot of learning about the describing of infodemic, and there isn't a lot of literature right now on what works. However, I will tell you the World Health Organization does highlight Uganda as a potential example of how to combat the infodemic. And in the example that I provided, when I talked about collecting data, Uganda relies heavily on radio for sharing information, and they use a lot of talk radio and call-in shows. So they are there are public health people and informatics people listening to these shows just to start collecting data. And again, the questions that people are asking and the statements that they're making. And then they're using that medium to push out the correct information in various different ways. So they are having a very quick feedback loop to that, and using, you know, one of their primary sources for information. And then they're also using billboards. So I'd have to say that they're probably an example that should be analyzed further.
Thanks so much for that. That's really interesting information. Related sort of to the same question, we've got two questions that just came into the Zoom chat from Tom and Zach. And basically they're around the idea that consumers shouldn't be held responsible for what is misinformation, and how can we address the idea of censorship and control the spread of false information while also taking into consideration the ethics of censoring and free speech in the US.
I'll take a stab unless somebody else is about to take a stab. I mean, it's this thing that we are figuring out on the fly, and certainly the, Twitter, probably more than any other site, has started to have to take this seriously, and Facebook now has this like panel of global experts that's considering whether Trump should be permanently banned. Some of the false information that he's posted on Facebook. And I think it's, a really open question, and it's problematic in a way that sort of we have these private companies that are so important for what messages people do hear and don't hear, and are making these decisions. And they haven't had a good track record of handling this well so far. And, I mean, one thing I was amazed by is right before, in December, when Trump was president, he wanted to pass the $2,000 stimulus checks, and he also wanted to revoke this protection that social media companies like Facebook and Twitter have, Rule 230, I think it's called, where they can't be held responsible for false information that's posted on their site. And I thought the Democrats should have just taken them up on that and said, like, fine, let's do it. And suddenly those companies would actually be responsible if people are using their platforms to spread information that is dangerous. And you would have seen, every social media company would have had to take a hiatus while they figured out how to handle this. It would have been quite refreshing, maybe. But I think you've put your finger on really like a tough issue right now.
Thank you so much, everyone, for these excellent questions. These are great. For the sake of time, we have to continue. We still are going to do closing thoughts from each of our panelists. So panelists, in just a few words, very briefly, please tell us, what would you say is the antidote or the vaccine for the infodemic? And please feel free to share your thoughts in the same order in which you presented.
Sure. So as I mentioned, I do think the answer to the infodemic is more education, more information literacy, tied in together with other habits of mind, such as tolerance for ambiguity and critical thinking. I think also sort of to build off what Brian was just saying, we have space to magnify good information, but also to not share information that is bad, whether it be in our curriculum or on panels that we're planning. So there's lots of space in our daily lives where we can magnify the good information and try to quiet the misinformation without actually censoring it.
Okay, I'll add something quick. So one thing I find encouraging, one of the things that Sonia brought up is the journalism in that green zone that tends to be more reliable. And there does seem to be a shift where they're more comfortable identifying misinformation as misinformation very explicitly, as opposed to just doing this like one side says this, one side says the other. And I think that's an encouraging development in journalism. And then something that Jennifer brought up, which is that even though it's, as I mentioned, it's elites that play such a huge role in amplifying these messages, that if you get a text from a friend or a private message from a friend passing on something that the elite said, that is what has a huge effect. And it does mean that regular citizens just have real power and potential to decide what gets spread and who gets talked out of what. There's a famous political science study where they asked people their opinions on certain factual matters. And, a lot of people got it wrong. But then when they paid you to get the answer right, there was a sudden shift because people kind of in their heart of hearts know what the truth is. And so, give your friends the right messages and then pay them to change their minds. That could work. It would probably work on Jennifer's kids too.
So my final words would be Misinformation is going to be endemic. It's always going to be here. But we can prevent infodemics. We can prevent outbreaks by making sure that information that's amplified and replicated is correct information. And also, if we go back and we remember that one of the most contributing factors to amplification and replication is instant messenger, like WhatsApp and iMessenger, those are tidbits. Those are small phrases and sentences and links that are shared. So what that means is maybe we need to have more conversations than just looking at headlines and sending texts.
Thank you so much to all three of our amazing panelists. Audience members, if you have more questions for our panelists, please feel free to reach out to them. They would love to hear from you. And before you leave today, please do fill out the brief attendance survey that has been dropped into the chat. Attending this event can be applied toward earning the Interprofessional Honors Distinction. And many thanks to our partner, the Center for Excellence in Collaborative Education, for partnering with the UNE Planetary Health Council to bring you today's event. Thanks to everyone for joining us, and we look forward to seeing you at some of these upcoming events.